the conditions, clinical conditions involving nitric oxide. First, think about angina pectoris. Angina pectoris. Pectoris, chest. Pectoral, chest. Chest pain involving a cardiac event is angina pectoris. Generally, heart is a pump. It's a muscular organ that is pumping blood to all other organs. But heart is also an organ that requires blood supply. So coronary arteries will supply the heart. The blood goes through the coronary arteries to the heart. Sometimes there can be a blockade in the heart. This can be because of a lipid mass atherosclerosis which blocks the heart's blood supply. When heart's blood supply is blocked, it can lead to ischemia because of poor perfusion. That can lead to complete death of the heart muscle called as myocardial infarction. Now let us not go there. We'll be focusing on the blood vessel supplying the heart. Imagine if this is the normal diameter of the blood supply to the heart. Then in case of angina, there is sudden shrinkage of the diameter of the blood vessel who's supplying the heart. So what do? I give nitric oxide. Nitric oxide will come here and relax the smooth muscles present in the vessels of the blood vessels. That is walls of the blood vessels. So when the smooth muscles present in the blood vessel wall are relaxed, then the arteries can start dilating. When the arteries start dilating, blood flow to the heart is restored. Now what is exactly nitric oxide coming from? What is the drug you give? I'll write the names of the drugs here. Isosorbide dinitrate. Isosorbide mono or dinitrate is a very commonly used drug. This will get metabolized faster to apply nitric oxide. It can instantly release nitric oxide. There is one more drug called as nitroglycerin. These are very old drugs, but this nitroglycerin will instantly produce glutathione. This glutathione will undergo metabolism to produce nitric oxide. This nitric oxide will cause dilatation of blood vessels supplying the heart. So heart will get the original blood supply back. Now what happens when there is continuous nitric oxide excess? This continuous nitric oxide excess can lead to continuous blood vessel dilatation. This may lead to hypotension. When can this happen? During infection, the macrophage based release of nitric oxide can be elevated. That elevation can keep the blood vessels more and more open. BP keeps on plummeting. This is referred to as shock. Two conditions where you can think about nitric oxide involvement. In your textbook, there is a condition called as eclampsia. What is eclampsia? Here, the mother who is pregnant is having epileptic seizures along with that of hypertension. This is dangerous to both the mother and the baby. Now, why is this happening? Because there is congenital resistance to nitric oxide synthase enzyme. You will be producing certain compounds which are capable of inhibiting nitric oxide synthase enzyme. So nitric oxide production is basically lesser, because of which there is consistent increase in the BP. So nitric oxide can decrease BP by dilating the blood vessels by relaxing smooth muscles.